CSC को डिजिटलाइजेसन अब यसको इश्युजहरु यसको रिलेटेड यो CSC रिलेटेड इश्युजहरुको चाहिँ पब्लिसाइज गर्नलाई चाहिँ डिजिटल प्लेटफर्म्स सच एज अब सोशल नेटवर्किङ साइट्स चाहिँ धेरै युज भएको देखेको छ। यो सोशल नेटवर्किङ साइट्स और डिजिटल प्लेटफर्मको चाहिँ रोल के हुन सक्ला CSC रिलेटेड इश्युजहरु चाहिँ पब्लिक माझ ल्याउनलाई?
As I said, like comprehensive sexuality is always been like curriculum based education, but it can be promoted through a various means. Like as you said, we can promote it for the students who are out of schools. There are different guidelines that supports comprehensive sexuality education, how it can be taught for in and out of schools. But in terms of digitalization of CSE, it would be a very great idea if that can be done, because the young peoples are very much now engaged. They are very keen to learn online digital platforms. They have access to internet and smart laptop like ICT materials. So having comprehensive sexuality education models on a digital platform or online would definitely attract the young people to learn, because these days young people, they are so keen to learn about sexuality, sexual and reproductive health. They do bloggings. They are super active on the social media, and the TikToks, these are being very famous. So if we use the contents of CSE, the right and age appropriate contents on the digital platform, on the social media or other social media platforms or digital platforms, it would definitely support young people to learn and know about the different topics of sexuality education, and that would be a very good tools and the mode of engaging with themselves. But the problem is the access to the digital platforms. So accessibility would be a challenge, because in context to Nepal, not all young people has that opportunity to have access to internet and digital platforms. So I would say the importance of digital platform is spreading comprehensive sexuality education or promoting comprehensive sexuality education through our digital platform is a great innovation. But keeping in mind that we need to ensure that the people who are particularly the vulnerable, marginalized, the poor people, the people who lives in a remote area, for them to access this digital platform is a challenge. And so for them, there has to be a very innovative community outreach actually. So digital platform and innovative community outreach, the combination of the combo of digital platform and innovative community outreach, which would definitely help promote CSE, help reach the target groups, the beneficiaries, the young peoples, and help them understand the aims and the right-based, and the right topics for the right peoples to learn and know about the different topics of comprehensive sexuality education.
We know that government has been doing a lot from its level to include CSE related topics in our course book, but when अब हामीले चाहिँ सानो बेलामा पढ्दाखेरि चाहिँ हैन, अब सानो क्लासहरुमा चाहिँ हाइजिनलाई चाहिँ बडी फोकस गरिन्थ्यो। अब हामीले चाहिँ गुड, अब अहिलेको कन्टेक्स्टमा त गुड टच ब्याड टच जस्तो कुराहरुलाई चाहिँ ल्याउनु पर्ने हो नि त, तर त्यस्तो खालको कुराहरु चाहिँ छैन, खाली हाइजिनलाई चाहिँ फोकस गरिएको छ। अनि हामीले चाहिँ पढ्दाखेरि चाहिँ अब 9-10 क्लासमा आएर मात्र मेन्सुरल हाइजिन रिलेटेड टपिकहरु चाहिँ त्यसमा इन्क्लुड गराइन्छ हैन। अनि यसो गर्दाखेरि चाहिँ एज बेस्ड CSE इन्फर्मेसन चाहिँ नदिएको हो कि जस्तो फिल हुन्छ। सो व्हाट आर द एफर्ट्स पुट फरवर्डेड बाइ द गभर्नमेन्ट टु हेल्प द प्रमोशन अफ CSE? Sir, could you please tell us about that?
Yes, worldwide, like many young, like particularly young women and young people today still struggling to have access to information, like comprehensive sexuality education, sexual and reproductive health services, which is very much needed to control their lives and safeguard their sexual and reproductive health and rights. Actually, that helps them, to make informed decisions, choices. But as you said, the topics related to sexuality, sexual and reproductive health has been confined, and it has been been seen as a taboo. It's not easily spoken or discussed among the youth and then the children or the parents, because the topic itself, as per our social and cultural context, and it cannot be openly discussed among the parents or the teachers. And if you're doing that, it's been considered as being like vocal, or like the whole issue of sexuality is still considered as a taboo in our society. And because of that, even teachers, they are reluctant to teach the different topics of sexuality and sexual and reproductive health. And since there has been so much discussions, movement by the civil society groups, young peoples, that's why the whole there has been the visibilities in terms of relations to menstrual health and hygiene, because around menstrual health and hygiene, and now it's being discussed openly. So in regards to sexuality education, still there is need to make a louder voice, and it has to be discussed openly. And until unless it is discussed openly, it's still going to be seen as a stigma and a taboo, and there is would be reluctancy for teachers to teach and the parents to educate the child about different topics of sexuality. So that's one of the reason. And then if you see what the government has done particularly in that, although there is contents in the curriculum to teach, might not be the various topics of sexuality, but still there is some topics related to reproductive health, reproductive systems, and then reproductive systems somehow they got like skipped by the teachers, and even the curiosities that comes from a young mind in regards to on the top to sex, sexuality, reproductive health, it did not get met. But definitely the government committed that they would invest for young people, including where the health and well-beings, young people's health and young people's are exercised their own benefits, and the government has committed that they will upskill friendly health services and will upskill comprehensive sexuality education.